This video continues Chapter 18 of OEC 6th edition with Principles of Trauma. Specifically, the objectives in this video are to define the mechanism of injury and describe 5 specific mechanisms of injury. Let's begin. Kinetic energy is the energy of a moving object. Now, the speed of the individual is the most important factor. From physics, we would say that kinetic energy is 1/2 mv squared. And it's this squared term up here that allows us to see speed matters more. If you double the speed, well, 2 squared is 4. You have 4 times the kinetic energy. If you triple the speed, 3 squared is 9. You would have 9 times the kinetic energy. So MOI is the type of force acting on the body to cause injury, and an injury pattern is associated with a specific source of trauma. Now, stopping distance matters as well, because we're going to take all of the kinetic energy that we may have in terms of movement, and we're going to bring it to 0. We need to bring our skier or snowboarder to a stop, and it's at that time that the kinetic energy is dissipated. Now, that can happen quickly or it can happen slowly, and the severity of an injury is more associated with that rapid dissipation of energy. So we can consider 5 types of MOIs. We see them here and we'll look in more detail. An impact or blunt injury is directly related to 3 factors. As we said previously, the amount of kinetic energy absorbed, but along with that, we need to consider the direction the KE travels through the body and the density of the body structures impacted. Let's look in more detail at that piece. That closed injury, that blunt injury, can damage underlying structures, including bruising tissue, causing internal bleeding, especially in the case of a solid organ such as a spleen, or something rigid like a broken bone, or further organ damage. We see blunt injuries in falls and collisions. A penetrating injury is one that breaks through the skin to damage underlying structures. Now, a small surface of the skin is affected when the object in motion strikes the body, but we can categorize the types of penetrating injuries into high and low velocity. High velocity wounds occur when the object is moving 2,000 feet per second or greater, as we might see in a hunting rifle or a military weapon. High velocity wounds cause tissue destruction because what can happen with that high velocity projectile is actually cavitation inside the soft tissues and fluids in the body, causing extensive tissue destruction. For a low velocity wound, we may see something such as a stab wound, and tissue destruction is really just limited to the actual path of the object. Another type of MOI is a rotational injury, simply twisting through an abnormal range of motion. We might encounter this with a slow twisting fall on a day with perhaps 6 inches of fresh snow and a beginning skier. We have this example where the lower leg may be twisted and cause a spiral tibia fracture. A crush injury is, as it sounds, when a body part is caught between 2 or more hard objects and the compressive force injures tissues underneath. This can also happen to an avalanche victim. Finally, we'll consider blast injuries. And blast injuries are divided into 4 categories. The primary blast injury is due to the concussive wave from the explosion itself. A secondary blast injury is caused by projectiles from the blast. A tertiary blast injury is caused when the patient collides with another object. So the difference between secondary and tertiary is secondary, we have the object striking the patient. In a tertiary, we have the patient striking the object. Finally, quaternary injuries are collateral injuries such as burns. We see that described more detailed here. Primary blast injuries, due to the pressure wave. Secondary blast injuries caused by objects striking the patient. Tertiary injuries, the patient striking an object, and quaternary injuries such as burns or inhalation injuries. Blast injuries may be associated in the ski area environment, such as kitchens or a backcountry environment like a camp stove explosion. Sometimes our patient experiences the blast pattern triad, where they have apnea, that is, a lack of breathing, bradycardia, a slow heart rate, or hypotension, low blood pressure. That's a nice review of some medical prefixes. The patient will return to pre-blast values within a short time. So in summary, MOI is the type of force acting on a body, and it helps us evaluate the injury pattern that results. OEC technicians should be familiar with 5 major MOIs.